60 to 70% of physicians report having at least one symptom of burnout, and about 80 to 90% of nurses report burnout symptoms. Physicians are now the highest profession for suicide rates in the country. The problem with burnout is that we've been sold a bill of goods. We've been told for centuries as nurses and doctors that the best way to avoid burnout is to not feel. We were taught things like detached empathy. We were told that by not feeling for our patient, by keeping it very scientific, we could actually protect ourselves and not get burned out. And it turns out that that's the exact opposite of what is true. You see, when humans act in a way contrary to their beliefs and their core values, it increases burnout. What does that mean? Well, I work in one of the largest neonatal intensive care units in the country. It's very busy, and I'm sure many people in this audience also work in really busy hospitals. See, in the middle of the night or during the day when it gets really busy and I admit a premature baby, or you admit a very sick person, I know that the right thing to do is, after I take care of the baby, to go downstairs, go to the delivery room, and tell the patient, the mother, how their baby's doing. I know that the right thing to do is to sit with that mother and tell her that I'm going to do everything possible to help save her baby. But I get busy. I got 3 admissions. There's nurses calling me all the time. I know there's a whole bunch of patients that I still have to see. So maybe instead of going down to speak to the mother, maybe I'll talk to the father who's at the bedside. Maybe I'll even pick up the phone to call her even though she's only 2 flights down, because I just get busy. But I just acted against my core values. I acted contrary to the reason why I went into healthcare in the first place, and that was to help people. I acted against the values that my mother and father spoke to me about. And so I go home that day, and I'm driving home, and I just saved a life. I just saw a whole bunch of babies, and I did good work as a doctor, but yet I go home and I'm feeling a little empty, feeling a little depressed. There's a certain emptiness inside, and I like to say a numbness in the back of my head. I don't know why. All I know is that I'm feeling a little sad. And the next day I go to work, maybe with better intentions, and I do the same thing. And then I repeat, and I repeat. And each day I get a little more depressed. I feel a little more empty, and I'm not sure why. And then after a while, I'm sad all the time, I'm depressed all the time, I'm a little grouchy, I might be short with the nurses or with my wife or with my kids. And those are all symptoms of what? Burnout. The burnout was caused by me not acting consistent with my core values. So it's the exact opposite of what we were taught. When we act consistent with our core values, we actually protect ourselves from burnout. So compassion is protective against burnout. So we lost our way, we became task-oriented, and now we have to become patient-oriented. We have to stop putting an emphasis on efficiency and put emphasis on courtesy and compassion. And not only will we reduce burnout, but we will significantly improve the overall patient experience.